Welcome to another PESA educational production, Massaging an Upper Eyelid after Droopy Eyelid Repair. Droopy eyelid repair is a procedure that raises the height of the eyelid. This may be combined with an upper eyelid blepharoplasty, which is a removal of extra eyelid skin and fat. Droopy eyelid repair is accomplished by tightening the attachment of the primary eyelid lifting muscle to the skeleton of the eyelid. This increases the power and effect of the opening muscle to raise the eyelid while still allowing the eyelid to close normally. There are several factors which temporarily and variably influence how the eyelid appears during surgery, making it difficult to predict the exact height of the eyelid. The good news is, this is a procedure that is fully adjustable. At Plastic Eye Surgery Associates, we're proud that our success rate for achieving the desired height and contour of an eyelid is 93%. That's better than the national average of 75% among all eyelid specialists. After surgery, if the eyelid is too low, it can be further elevated. On the other hand, if the eyelid is too high, it can often be simply corrected with eyelid massage alone. Your physician will help you to identify these situations and tell you when to begin the massage. Upper eyelid massage is indicated in two situations: an eyelid that is overall too high, where there is space between the upper eyelid and the colored part of the eye, and an eyelid that is peaked. In both cases, no white space should be visible. Here then are the corrective steps to follow in upper eyelid massage. First, make sure the eyelid is clean and free of oils, moisturizers, and ointments. Next, identify the highest point of the upper eyelid between the eyelashes and the incision. This is the spot of maximum massage benefit. While facing forward and moving only your eyes, not your head, look down towards the floor. Do not close your eyes as you do this. With your finger, press hard enough against your eye so that the eyelid does not move. You should feel a pulling sensation in the eyelid that you are holding down. The looking up phase need to last no more than 1 to 2 seconds. The important stretching effect happens mostly during the upward movement of the other eye. Typically, we recommend doing this at least once an hour, or 10 times a day, with 10 times at each sitting. That's a total of 100 upper eyelid movements while holding the operated eyelid down. Earlier massage after surgery is often more rapidly effective than later massage. Your physician will direct you as to when you should begin your massages. Don't worry about massaging too much. Overcorrecting by massage is extremely uncommon.